Hi everyone, my name is Valentina Guatibonza Garcia and I am a PPCR TA1 since last year. Today I am going to talk to you about how to build a research question and don't die in the process. First, I would like to start with this statement. As you will learn, developing your research question is an evolutionary process, and research itself is a continuously changing and evolving field. You have to always keep in mind that this is always changing. You will have to change your research question depending on your environment and your resources. This is the agenda for today. You may already be familiarized with the PICOT format to build a research question, so let's start. First, I want to make you an overview of where the research question comes from, so let's start. A research question is an inquiry about an unanswered recent scientific problem. I know this is like the definition, but it's more complex than you think. So what are the steps to build a research question? First, you have to select a topic of interest, then you have to identify a research problem within this area, then formulate a research question, and then state an overall research objectives. So let's keep in mind that in this process, you have to go from broad interests to narrow research questions. Why? Because we want to avoid what we call a fishing expedition, because you will have a lot of results and you will don't know what to do with all of this information. So where a research question come from? You maybe have already noticed that in your practice, you have some knowledge gap that you must or you need to address. For example, I don't know, in many fields, what is the best intervention for some patients with determined characteristics. So this is the knowledge gap you want to address. And it's very important to know what is known and what is not known about that topic. So let's go to Medline, PubMed to know what is already studied. And now, what the research question, all the research questions must be important, must be feasible, must be answerable, and must be ethical. Important, you must question or ask yourself if if your question is relevant for the scientific field. If it is realistic, with the resources you have available. If it is answerable, what that means that new knowledge can only originate from questions that are answerable. And ethical, you always will have to keep in mind what are the risks and the benefits, and if the population you are studying is vulnerable, and what are the possible adverse effects, or if your intervention is harmful, you need to address all that. And then I have here some important points that you want to keep in mind for each of the characteristics a research question must have. For example, if the importance of it, the feasibility, you will have to keep in mind if you have enough patients. Well, you will if you have enough people with the technical expertise, if you have enough time, what is the funding, what is the research environment. Regarding answerability, you will have to keep in mind if the literature review that I already mentioned, like what is known, what is not known. You will know exactly what are the current guidelines of the pathology, what you want to answer, you want to study, and know well the standard of treatment. What is the current treatment that is for the pathology that is established. And the ethical aspects, you will learn there are a lot of controversial topics that you have to keep in mind. So as I mentioned, if the population is vulnerable, what are the possible risks, what are the possible benefits, and all of that. So there are several ways to express a research question. First, the hypothesis is the statement about the expected results that predicts the effect of the intervention or exposure on the outcome. So for example, it's like what you expect. And there are several types of questions. For example, the basic complex difference group, that is just comparing two groups. The basic complex associational questions, that is like a dependent variable that has a relationship with the independent variable. The dependent variable that has a relationship with the independent variable, and there is only one of each. And the basic complex descriptive question, that is where the data is presented like just with the objective or the aim of present a description of the data. So measurements of central tendency, variability, and percentage. So let's start. What is the population? So this is the first step of the PICOT question. The population is the target population of your research. So population refers to the sample of subjects you wish to recruit for your study. It's important to keep in mind to balance between a sample that is most likely to respond to your intervention and one that can be generalized to patients that are likely to be seen in actual practice. Though this is just to keep in mind generalizability and external validity of the study. Then you have your target population, then you have to select a sample that is your study population, keeping in mind the inclusion and exclusion criteria. This you will refine this depending on what you have learned, what you know, and all of that. Then is the intervention. The intervention is the independent variable. So the intervention refers to the treatment that you will provide to subjects enrolled in your study, but it can be understood as the independent variable, and it can be not necessarily an intervention, but an exposure in the case of an observational study. In an experimental study, this variable is fixed and is controlled by the investigator and is a drug, a prognostic factor, or a diagnostic test. And in the observational study, is an uncontrolled variable that you know as the exposure. Then the comparison. Here, you will learn that this is the group you are comparing against. So, for example, it's like what you want to compare against with. For example, in the case of an intervention, you want to compare against placebo or the current treatment of the gold standard. So you will learn that this is the control group, for example. So here we have two types: the placebo that is the like the comparison group that we know as the simulated treatment that has no pharmaceutical effects and is used to mask the recipients to biases. And the active control, that is, for example, the current treatment of the pathology you are treating. So this is an active control because it's already established and it has a pharmaceutical effect. Then comes the outcome. The outcome is the dependent variable. So the outcome represents what result you plan on measuring to examine the effectiveness of your intervention. So here you have to keep in mind several points. What can be measured in a timely and efficient manner, which measurement is relevant to evaluate the effect of an exposure, and what is usually accepted in your field. So here you will learn later that you can use surrogate outcomes or strong outcomes, like, for example, I don't know, like a lab test versus a death, for example, or mortality. It will depend on your available resources, the time you have, etc. And finally is the time. So the time refers to, it can be refers to two things, like the duration of your data collection, or the follow-up time you need to assess the outcome. So for example, I need to assess my patients for a determined intervention for 5 years or for 10 years. So I have to follow the patients that are exposed to some I don't know, environmental factor. So I have to follow them, I don't know, for 10 years. Or, for example, the treatment can be for like 10 years or 1 year or 6 months. It depends on what is already known. And finally, conclusion and references. This is just like to finalize, just to keep in mind that a good research question leads to useful findings that may have a significant impact on clinical practice and healthcare, regardless of whether the results are positive or negative. So just keep in mind that if you have a very good research question, like with all the aspects I just mentioned, you will like you embrace your results, whether they are positive or negative. They will be useful anyway. So thank you. This is my email, and thank you so much.